Hi everyone, I'm Nardine Nakla. Welcome to the module Decision Making and Documentation, Keeping It Simple, Part 1. In the practice of pharmacy, clinical decisions take many different forms. Even something as routine as releasing a new or refill medication to a patient can be considered a clinical decision. The pharmacist has decided that the medication is appropriate for that patient at that time. It is important not to downplay the value of decision making as part of routine care. Pharmacists are constantly making decisions in our everyday practices that impact our patients. Today, pharmacists are being called upon to use our full scope of practice to play a more active role in the provision of care. This means making more clinical decisions and having a greater impact on patient outcomes. However, some pharmacists are reluctant to assume a more active approach to patient care because they feel that they are taking on additional responsibility, or they feel that they may make the wrong recommendation. It is important to note that the choice to do nothing is also a decision that may negatively impact patient care, and thus doing nothing may be the wrong decision. If we make decisions all the time, why is there this fear of making a wrong decision? What makes some decisions more difficult than others? Part of the answer is the amount of uncertainty surrounding the decision. There are sources of uncertainty that cannot be controlled, such as the availability, relevance, and quality of scientific evidence, how a specific patient may respond to therapy, or the inability to access diagnostic test results. Part of decision making is accepting that, despite your best efforts, there will always be some level of uncertainty in your decisions. It is therefore imperative to have a plan in place to manage the uncertainty. The plan should include positive endpoints, or your threshold for determining if your plan is successful. For example, fasting blood glucose between 4 and 7. Negative endpoints are the unacceptable potential consequences of your plan that would warrant a new plan. For example, signs and symptoms of hypoglycemia. When to evaluate these endpoints, and when the patient should seek urgent care. The more unknowns there are when making your recommendation, the more thorough your plan should be to ensure the safety of the patient and to foster favorable outcomes. Let's take a look at a scenario to help illustrate these points.
Thank you for speaking with me today, Mr. Geller. So you mentioned to Morgan, our technician, that you have a lot of your medications left at home, so you don't need those refilled today, but you would like this new prescription filled.
That's right. That's all I have to do today.
Okay. Well, do you know approximately how much you have left at home? Because it looks like that last time we filled your medication, we gave you a 3-month supply, and that was actually just over 3 months ago. So you should be running low by now.
3 months already, eh? You know, to be honest, my memory isn't what it used to be. I have trouble remembering whether I've taken the medication or not, you know, and when that happens, I don't take the pill because I'm afraid that I might double up. I didn't realize it was happening that often. My pill containers, they're probably half full still.
Okay. Well, it sounds like remembering to take your medications is becoming troublesome for you. Well, we do have many solutions in the pharmacy that I think can help you. Have you ever considered using a pill organizer?
No.
Okay. We have many, and some of them have one box for every day of the week, which I think is great because you can just take a look and see if you've actually taken the medications for the day. And we can get them all filled in advance for you. Do you think that might work for you?
Yeah, I think that would work well. I mean, you know, the funny thing is I remember when I have to take the medication. I just get confused about whether I took it or not, but this is something I have to do something about. Yeah, I think that pill organizer idea is a good one. I think that would help me tremendously.
In this situation, the first major issue is that the patient is forgetting to take his or her medication. The pharmacists work with the patient to come up with a solution to overcome this issue. Let's see what happens next.
Okay, we can certainly help with that. Before I get everything ready, though, I do have a couple of questions for you. So this new medication is for amlodipine. It is used to lower your blood pressure. When you were at your doctor's office today, did she get a chance to measure your blood pressure?
Yeah, she did. She said it was high. She said the reading was 148/96.
All right, and was she aware that you had been forgetting to take some of your medications, particularly the ramipril and the hydrochlorothiazide?
It didn't even occur to me to talk about it. I mean, I didn't think it was an issue at the time.
Okay, so I am a little bit concerned, and I think that your blood pressure may have been high at the doctor's office because you had been forgetting to take some of your medications. So if we focus on taking those medications more regularly, it just may be enough to lower your blood pressure and bring it under control. So by adding on the new medication, the amlodipine, it might actually drop your blood pressure too low. You know what? I'd probably recommend for today that we hold off on the amlodipine for now and just really focus on helping you to remember to take your medications more regularly with the use of the pill organizer. Maybe in about a week I can call you and we can see if you've forgotten any days. And then maybe in about 2 weeks, we can bring you back to the pharmacy and check your blood pressure. And then at that point, we can decide whether or not we need to fill this new medication. Does that sound all right with you?
It does sound all right. It makes me feel like I'm in good hands. No, if you think this is best, I'm on board.
Perfect. And do you think you'll be able to drop by in 2 weeks so I can check your blood pressure in the pharmacy?
Sure, that should be no problem at all.
Wonderful.
Let's recap. Once the pharmacist addressed the first issue of poor compliance to medication therapy, another issue was uncovered, which was that the patient might not need the amlodipine. Additionally, there is potentially a third issue, which is the patient's underlying forgetfulness, and the pharmacist may choose to address this at a later time based on the priority of the issues at hand. The documentation from this interaction might look something like this. 1. BP 148/96, MD's office, confirmed in pharmacy. 2. Patient also taking ramipril 5 mg BID and hydrochlorothiazide 25 mg daily. 3. Patient reports poor compliance to existing meds, about 50% based on fill dates and remaining quantity. 4. Recommended dose set to first improve compliance with ramipril and hydrochlorothiazide. Assess pill count in 1 week. 5. Check BP in 2 weeks. If still greater than 140/90, then start amlodipine. 6. RX placed on hold for now. There are many different ways this scenario could have played out, and it's difficult to say which options would work best for this patient. The pharmacist acknowledged this uncertainty by formulating a plan to evaluate both of his or her suggestions, assessing compliance with the pill organizer after 1 week, and assessing the blood pressure after 2 weeks of improved compliance on the existing medications. The plan may still need to be changed at either of those points, but the important piece is that there is a mechanism in place to make modifications if necessary. In addition to uncontrollable uncertainty, there are also sources of uncertainty that we can control, and those are the ones that exist with ourselves and our abilities. How do we determine if our decisions are good decisions? Confirmation with another healthcare provider can be reassuring, but others may have differing opinions from you. And while that does not mean one of you is more correct than the other, it may still shake your confidence. A positive outcome for your patient is always desirable, but some patients will have poor outcomes despite your very best efforts. Therefore, confidence in your decisions must come from within. It may be helpful to develop a procedure that instills confidence in your decision when followed correctly. For example, after making a decision, ask yourself the following questions. 1. Did I use all the information available to me at the time? 2. Did I consider the advantages and disadvantages of the various options? 3. Did I act in the best interest of my patient? 4. Can I justify my decision? 5. Do I have a plan in place? If you answer yes to all of these questions, then be confident in your contribution to patient care. Take a moment to reflect upon the previous scenario. Would you have been confident making the same recommendation? Would you have approached the situation differently? How would you have monitored the patient to ensure he or she was getting the most out of his or her medication therapy? Would you be able to justify your plan to another healthcare provider? Before we close, let's look at a question to review what we've discussed in this module. Which of the following is true regarding clinical decision making? A. All of your decisions should be confirmed with another healthcare professional. B. You should always have a plan in place to manage uncertainty in your decision. C. You should always pick the option that generates the most income. Or D. Choosing to do nothing excuses you from responsibility. The answer is B. You should always have a plan in place to manage uncertainty in your decision. Remember that we are the drug experts, and patients rely on us to help get them the most out of their medication therapy. Embrace the opportunity to make clinical decisions to advance patient care in your practice. We already make hundreds of decisions a day, so recognize that clinical decision-making does not need to be overly complex or intimidating to have a large impact on patient care. With practice and experience, our clinical decision-making skills will continue to evolve, advancing patient care. Don't be afraid to implement these skills in your practice. I wish you the best of luck.